We would usually think about the survivorship concerns in terms of the physical impact of cancer treatment and the cancer itself, and also the psychosocial impact of cancer and its treatment on patients in the long term. The physical impact of treatment for esophageal and gastric cancer usually relates to patients' ability to eat in a normal way and ability to enjoy the process of eating. And that can have a downstream impact on psychosocial functions. So people's ability to enjoy a meal out with friends and family without feeling under pressure, for example, is something that we see a lot in our survivorship group. So there's been some fantastic work done by patient organisations, such as the Esophageal Cancer Fund in Ireland, in helping people to develop strategies to normalise these difficulties with eating. For example, the Esophageal Cancer Fund now provide patients with small cards that they can present at restaurants to highlight in a subtle way that they would like to request a reduced portion size or that they may need extra time with their meal. So these are the type of issues that we study in the long term after treatment for esophageal and gastric cancer, but there are many other issues that affect patients. Common things would be neuropathy, peripheral neuropathy related to chemotherapy, as well as persistent fatigue and reduced energy and activity tolerance. These symptoms came out in a big European study that we recently completed with our collaborators in Oxford University, which is called the LASER study, and looked at key survivorship issues across people who'd had treatment for esophageal and gastric cancer who were free from cancer recurrence in the long term. And the key issues that came out in the LASER study were eating symptoms, fatigue, and reduced exercise tolerance. So the final kind of key area that we're working on in conjunction with our colleagues in physiotherapy and rehabilitation is on developing rehabilitation protocols and strategies from an exercise point of view that will help people to regain their energy levels after this type of treatment. And we think that this kind of holistic all-around approach, looking at nutrition, exercise, interventions and physiotherapy, but also looking at those psychosocial effects of treatment is the most effective way of looking at these survivorship issues in people who've had treatment for esophageal and gastric cancer.